Welcome back, everybody. I'm the Doc Bob Lee for 107.5 WBLS. Welcome, welcome, welcome. You have a seat at the table, and it's a beautiful thing. Our next guest, our school principal for the New York City Department of Education, was with us today to speak about her fight with colon cancer. And she is joined by the Director of Colon and Rectal Surgery of New York and Gastroenterology Specialist for the Gastroenterology Associates of Brooklyn, who share insight on colon cancer treatment options. So please welcome to the show, Dr. Lisette Caesar, Dr. Lynn O'Connor, and Dr. Cynthia Quainoo. Welcome, welcome, welcome. Now, you guys are no stranger to the show. Lisette, you know, I've been to your school many times before. I love what you're doing with the students there. They love you, and the school is like flourishing because you know what to do. I wanted to ask each of you just to tell me a little bit about you before we delve into what we're going to talk about.
Hi, I am Dr. Lisette Caesar. I am the founding principal of Mosaic Preparatory Academy, a school in East Harlem, New York. And in 2019, I just had finished my doctoral studies in educational leadership, and I became very ill. And I just thought I was just exhausted from 3 years of studying and working as a principal and some other jobs. And took 2 weeks off from work thinking that would help rejuvenate me. Unfortunately, I continued to be sick, lots of vomiting, not being able to hold food down. And so I went to urgent care. They said maybe just a virus. And so they gave me some things for a stomach virus. Unfortunately, I kept going back to urgent care and to my regular doctor until May 3rd, 2019. I ended up going to work with 104 fever. My secretary drove me home. She's like, "You can't be here." I went back to urgent care where they had to call an ambulance for me. And so I ended up going to NYU's emergency room where they diagnosed me with diverticulitis and said that I need to have immediate surgery because I had an abscess. And that was after them doing a CAT scan. I stabilized in the hospital that night, so they didn't do the surgery until Monday. And then I had drains coming out of me for a while. And it was a little scary that week because that was the same week I was supposed to be hooded for my doctoral studies that Saturday in Albany. And here I am lying in the hospital and not knowing exactly what was going on. And so this being sick went on for 4 months while I had at that time 12 CAT scans and kept being told I had diverticulitis. It wasn't until I decided to visit other GI doctors. I attempted to get a colonoscopy because I was so acute and constantly sick and going to the emergency all the time. No one would do a colonoscopy.
Yeah, and they don't want to give you a colonoscopy either because they think they're going to puncture something if you have diverticulitis.
So I met Dr. Ree, who was a colorectal cancer surgeon, and she said I needed immediate surgery. And so I had colon resection surgery July 23rd. And when she opened me up, she saw a mass. She didn't immediately tell me when she came to visit me in the hospital room, although I think she knew. It wasn't until I went back to her office on August 5th that she told me I had stage 2 colon cancer. And so I've been battling colon cancer off and on since 2019. Initially, I had 12 rounds of FOLFOX infusion. I have a port inside of me. I was told in April 26th that I was done with those cancer treatments. And then a month later, I was told I was cancer-free. So a year later, the cancer came back. It had metastasized to my liver. So I had my entire gallbladder removed and part of my liver removed. And now I'm on a daily regimen of chemo and some other vitamins and things I do to try to just stay healthy.
I am Dr. O'Connor, and I am the director, owner, operator of Colon and Rectal Surgery of New York.
And Cynthia, Dr. Cynthia Quainoo.
Hi, I'm Dr. Quainoo. I am a gastroenterologist and hepatologist currently in private practice in Brooklyn. My primary area of interest is colon cancer awareness and prevention.
So, Dr. Lisette Caesar, you have a wonderful team of people around you, helping you get what you need out of life and helping you to move in that right direction. And I don't know how you do it because you also have all of those children that you talk about at the school. You know, do some of the children know what you're going through?
So when I came back, because I was on medical leave for 14 months the first time I had cancer, when I came back, kids had a lot of questions, and I came back in the middle of the pandemic. So they kept asking me, was cancer contagious? The way that, COVID is contagious. So I tried to find books about cancer to explain to kids that it's not contagious, but it is preventable based on our diet and exercise and just our overall wellness. But I didn't find any books that looked like me, that spoke to my particular type of cancer. And so I ended up writing my own children's book, and primarily for my own students, so that they have an understanding of what I'm going through and how the first time I went through cancer, that they sent me lots of letters and pictures and videos, and their love really helped me get through that year of going through cancer treatment.
Yeah. Dr. Quainoo and Dr. O'Connor, this is for you. Why is it important to continue raising awareness for colorectal cancer?
It's really important because colorectal cancer is one of the most preventable cancers that are out there. It's also one of the most common. It's the second most common cancer that we have in the United States, and both men and women are roughly equally affected. But with proper screening, proper awareness, with dietary restrictions, with dietary and risk factor prevalence awareness, this is something that we can actually prevent. We're supposed to have approximately 150,000 new cases this year, and about a third of those will be deceased from colorectal cancer this year. And the interesting thing is we've even found that colorectal cancer rates are increasing in younger patients. Mm-hmm. So getting the word out, letting people know about this disease and that it's preventable, it's beatable is key.
Yeah. Dr. Quainoo?
Yes, so yes, raising awareness is important also because it's kind of not a sexy topic to talk about. And I feel like the more we talk about it, the more we remove any stigma that we have socially about talking about digestive diseases, and also talking about the procedures that are involved for proper screening. There's also a lot of stigma about that as well. And the more we kind of talk about and describe these things, people are less fearful of having these screenings done.
Dr. Quainoo, what are some of the preventive measures that can be taken, and how is this treated?
So in terms of prevention, first and foremost, getting screened is of the utmost importance. So if you're an average risk individual, meaning you have no family history of colon cancer or colon polyps, you should begin screening at the age of 45. If you have a family history, your screening can begin at an earlier age, depending on the family member that's affected and how old that individual is. So it's also important to talk about family history and share that information within the family as well. Diet.
Go ahead. Diet,
exercise, alcohol intake, and tobacco use are also modifiable risk factors that we need to discuss as well. So excessive alcohol use and tobacco use, obesity, and diets that are high in fat and low in fiber, fruits and vegetables are often thought to contribute to your risks.
And you mentioned something about polyps. Tell our audience what that is.
So polyps are small abnormal growths of tissue that can grow in the colon. Colon cancer screening with colonoscopy is geared at removing those benign growths of tissue before they can grow larger and become problematic or become colon cancers.
Dr. O'Connor, who is mostly impacted by this? We mentioned younger people are getting colon cancer, but who's more impacted by colon cancer, colorectal cancer?
So although we are seeing younger folks being impacted by colorectal cancer, it's still a disease of the older population. The problem is that it's just becoming more problematic in the younger population because these risk factor prevalences that we see are more prevalent now in this population, such as the obesity, the sedentary lifestyle, the diet. We're in an Uber Eats type of community. But when you look at stage for stage, African Americans have a higher rate of colorectal cancer than any other race. We are 20% more likely to be diagnosed with it, and we are 40% more likely to die from colorectal cancer. And that's largely because of the diet and prevalence factors that were just spoken about, as well as access to care and disparity. So the healthcare disparities that exist. So when you're looking at who's affected, you know, this is disease that's equal opportunity for men and women. Men are slightly a little bit more a higher prevalence. However, because women live longer, it's roughly equal. And then when you're looking at it across racial disparities, African Americans by far are have higher rates and higher morbidity and mortality. But with screening, that's where we make the difference, because screening colonoscopies save lives.
Thank you guys so much. I wish we can talk more about it, but you're always welcome to come back. Lisette, you know, you're my heart. Dr. O'Connor, pleasure meeting you. Dr. Quainoo, thank you. You're no stranger to the show. You're always welcome to come back and share your thoughts and educate our listening and viewing audience. We appreciate you and we love you guys.
Having us.
Thank you very much for having us.
Where can we go for more information? Is there a website or?
I have my website, www.colon-and-rectal-surgery of New York. It's spelled out just like that. There's a lot of information regarding screening, regarding diet, regarding education. Exercise is important. I am 2 offices in Huntington and 1 in Rockville Center. I'm in private practice. You can locate me at any time on that website to schedule an appointment or further consultation.
We love you guys. Thank you guys so much. Thanks for sharing. Thanks for
informing. Add something?
Yes, go ahead.
So for parents and caregivers who want to talk to their kids about cancer, who has cancer in the family, my book is available on my website, littlelizzie.org, as well as in Amazon.
Thank you guys so much. We appreciate you.
Thank you. Thank you for having us.
Very much for having us.
All right, we'll take a break. I've got more open. Keep it right there. Kick off your shoes and relax your feet. Here we go. More coming next.